Okay.
All right. And so again, for the sake of demonstration, CSA, we've done the primary survey. I've introduced myself, gotten permission to treat Scott, and now I'm on to my secondary assessment because I have not found anything that is life-threatening. Scott, hey man, now this is a very, I don't want to say intimate, but you are going to have to touch the person. So it's really, you got to explain to them what you are doing. Hey Scott, I understand you're hurt. I want to make sure we don't miss anything. So if it's okay with you, I'm just going to go head to toe and check you out, okay? But I'm gonna have to put my hands on you. Is that okay?
Yeah.
Okay, great. Here, you can just. Is this arm doing okay?
Yes.
Okay, all right. So I'm gonna take your hand off. That's all right. All right. And I'll tell you what I'm doing here.
Okay.
All right. So I'm gonna start at the top of your head. All right. Does anything that I touch hurt?
Yeah.
All right. Well, I got a glove on. Hopefully, I can check and see if I have any blood on my hand. All right. Got a flashlight. I'm going to look in your ears. I don't see anything. I would reassess pupils if I had already done that. Just go ahead and look again. Just going to take a quick look in your pupils. Okay. Look in your nose. Can you open your mouth up for me? Can you close your mouth? Put your teeth together and clench your jaw. Does that feel normal? Or does it feel like it's
it feels normal.
okay. I'm going to touch your face, all right? Okay. So I'm feeling his cheekbones, one side at a time. Does that hurt?
Yeah.
Does that hurt? Does your nose feel okay?
Yeah.
All right. And jaw, anything there?
No, that's okay.
Okay. How about the back of your neck?
Yeah.
You tender in the back of your
Yeah,
neck. All right.
yeah.
So right there, if I've got the resources, Randy, would you mind just holding C-spine up for me? I want to. C-spine is or spinal immobilization in general is a very controversial topic. We'll get into it, but if someone's neck is tender, that is a good reason to have someone just kind of help them prevent from moving. Okay. I'm just going to feel the front of your neck here. I don't see any jugular vein popping out, and the trachea is midline. You hurting here at all?
Just real sore.
Okay. All right. I'm going to feel each arm. So I'm walking my fingers out the clavicles. You feeling the scapula? Does that hurt?
No.
Okay. I'm going to feel your arm. Does that feel okay?
Yeah.
Yeah, all good there. I'm going to check a pulse. I've got a good strong pulse. Which finger am I touching?
Middle finger.
All right. Can you give me a thumbs up? Great. Give me a squeeze. Okay. I'm going to check this arm now. So clavicles, scapula, checking the upper arm. Is that all good? Okay. And checking a pulse. Give me a squeeze. Give me a thumbs up. And which finger am I touching? Okay. If the patient's unresponsive, the finger squeeze is not a good idea because people have reflexes, and so if you stick your fingers in their hand, they will sometimes squeeze even though they're not doing it, they're not following commands, it's just reflexive. So for a patient who's less responsive and not oriented, I would want them to give me a thumbs up. All right, I'm gonna check out your chest now. Feel like you're breathing okay?
Yeah. Okay.
Tell me what hurts. Okay there?
Oh, yeah.
Right there? Okay. Take a big deep breath. Hard to breathe? All right, okay. So he's got some tenderness on the right side of his chest. I'm gonna touch your belly now, is that okay?
Mm-hmm.
All right. You tell me if anything hurts and take a look. And for all of these, I really need to look too. In the hospital, we get people naked. In the woods, that's not appropriate for temperature concerns. So you just have to do the best you can. Pushing on your right upper quadrant, that feel okay?
Mm-hmm.
And down here feels okay?
Mm-hmm.
And here?
Mm-hmm.
And here?
Yeah.
Okay. I'm gonna touch your pelvis here. How's that feel? Fine? All right, so I'm just pushing in on the pelvis for, again, feel for any stability or tenderness. And I'm gonna check each leg out, okay? Randy talked about just kind of pressing on it, okay? Anything hurt over
Yep,
left
right there.
knee?
Yeah.
Okay. All right. I'm feeling a pulse. Got good pulse in both feet. Can you push against my hand? Pull against it. All right. Which toe am I squeezing?
Big toe.
Okay. Are you able to straighten that leg out or no?
I'm not sure.
That's okay. You don't have to. Can you wiggle your toes for me? Okay. Can you tell me which one I'm squeezing?
Big toe.
Okay. And he's got his shoes on. I can check a pulse behind his tibia there. So all these situations, like I'm not going to make someone do something that hurts them. So if he wants to keep his knee bent, that's a position of comfort, that's fine. So I never really got a history on him, but assuming, let's just say he fell, I've got a tender spine, cervical spine. I've got a tender spot in the chest, and then a tender knee, a painful knee. So my differential is going to be cervical spine fracture or injury, rib fractures, and there's underlying structures like your lungs there. So I'm thinking, does he have a popped lung or something more serious underlying that? And then a potential knee injury. And then, so I would want to check his back too if he had multi-systems trauma. So Scott, we're just going to roll. You ready? He's going to hold your head here. And on the count of 3, I'm going to roll you toward me. Your count, Randy? Yep.
1, 2, 3.
I'm just trying to keep him kind of neutral. Now I'm going to feel all the way down. You tell me if anything hurts. Does that hurt? 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 All right. Can you squeeze your butt cheeks together? Okay, very good. And back down.
1, 2, 3.
And that squeezing the butt cheeks together, that's just looking for making sure that his peripheral nervous system's all intact. Okay. That's the head to toe.